Alright guys, welcome back to the quarantine lecture series. We're talking about PTA 140, our therapeutic exercise course today, and we're talking about kind of our Olympic lifts. So there's two main Olympic lifts that we want to touch on, and I just want to touch on the two articles that we have for class. I don't want it, this isn't going to be the traditional kind of 40-minute PowerPoint, or not 40, hour and 10-minute lecture with a PowerPoint. I just want to kind of run through these two articles and really highlight. So I'm really just want to highlight some of the background and some of the techniques that they discuss about. As I talked about in class, these articles are both by the NSCA over here. So this is just kind of one of the bigger governing bodies of strength and conditioning. This is who does the strength and conditioning, the CSCS certification, which you've heard me as kind of describe as kind of the gold standard from this arena. So there's lots of stuff that we can learn from people in this arena. In the health world, we are kind of seen as the movement and strength and conditioning specialist, but if you don't kind of expand your horizons in this area, you're kind of missing out because there's a lot of really awesome information. These two articles are two of them. Okay, so the back squat, a proposed assessment and functional deficits and technical factors that limit performance. There's a ton of good information in here, both on just technique for squatting as well as clinical application. So just kind of going through, the first things that I have highlighted are kind of just the background. So the back squat is widely regarded as one of the most effective exercises to enhance athletic performance because it necessitates the interaction of numerous muscle groups and strengthens the prime movers needed to support explosive athletes. Okay, you're going to hear the term in these two articles, you're going to hear the term posterior chain a whole heck of a lot. And there's a reason for that. Okay? Because in order for us to function correctly and have correct movement patterns, we need to have a strong posterior chain. That's just it. There's no ifs, ands, or buts about it. So these two exercises, the back squat and the deadlift, are two of the best exercises to do that with, to strengthen that posterior chain. Okay? The background goes on to say many everyday tasks, such as lifting and carrying heavy objects, which relates to this exercise to improve the quality of life. Especially the posterior chain in the recruitment patterns. Okay? So strengthening those posterior chain muscles, hamstrings, glutes, erector spinae, okay? Those muscles are going to be able to be turned on and off easier the stronger they get. Okay? Specifically, it's really helpful with doing close kinetic chain exercises to avoid excessive strain being placed on the anterior cruciate ligament, making the squat a favorite exercise for rehab. And that's totally true. It is absolutely appropriate for you with your semi-fresh ACL patients who have a strong quad contraction, who are lacking posterior chain strength, for you to start with squatting with them. Okay? I mean, I'm not talking loading the bar down with 600 pounds, but doing mini squats correctly in the parallel bars. Okay? Correcting those movement deficiencies that we will talk about later, because that's what this does. Okay? We will talk about those deficiencies, but correcting those deficiencies from week 6. And you don't have to wait until they've been cleared to run and cut, because those things place extreme load on the ACL. Okay? We can start squatting with them, with our patients, as soon as they start having kind of good quad control, strong quads, good hip control. We can start getting them mini squatting in the parallel bars to really load the system and create change. Let's see, what else? Back squat exercise is most often prescribed with an individual starting in a standing position with the feet flat on the floor, the knees and hips in a neutral extended position, and the spine in an upright position with the preservation of its natural curves. Okay? And if you go to the gym, you'll see all kinds of techniques that are just wrong. Okay? So I challenge you to kind of, if you go to the gym and you're interested in this, really dive into this article and really get familiar with the terminology. Okay? A common instruction is to descend until the top of the thigh is at least parallel to the ground and the hip joint is at least level with the or slightly below the knee. Not really required. Okay, we can do with our patient population who have strength deficits. We can start at a 45. We can just do a mini squat. The key is going to be preventing preventing any substitutions or any bad technique, with the goal of eventually being able to get down into that position. Okay? And we'll talk about the knee transposition too far forward. We'll talk about the hips maybe swaying to one side, especially with us. I mean, in our realm, we're helping people regain function from usually a unilateral injury. Okay? So you're going to see those hips duck to the weaker side or the stronger side on the way down and probably on the way back up, especially in that transition from the descending to the ascending. All right. So further down, it just says standardized assessment. So it's going to talk about, kind of break it up into a couple sections. First one is the arm position. Okay, you want to use a plastic dowel or a wooden dowel, something that doesn't have any weight but actually is able to take some load. Okay, a cane works really, really well for this because you don't want to load them when we're just working on techniques. Okay, so you want the arms up. You want that bar straight across C7. You want your scapulas retracted so that the bar is kind of sitting on your upper trap. You want your arms or your hands pronated. You don't want a reverse grip or anything too wild. Pronated. Okay? And kind of your elbows driven back. Again, I talked about this in class, but this table kind of summarizes a lot of what we're going to go over. And we're going to hit a lot of these first things. We're not going to dive too far down into the descent depth and ascent going up. Okay. So the stance position, the heels approximately shoulder width apart and toes pointing forward or slightly outward by no more than 10 degrees. And there's a couple of reasons why for this. A wide stance may increase patellofemoral and tibiofemoral compressive forces in the knee by up to 15%. We don't want to increase that at all. So anything that we can do to avoid that increase, such as a wide stance, we want to obey. Okay? However, an excessively narrow stance may increase forward knee translation and therefore heighten the anterior shear forces on the ACL. Okay, so we want the shoulders about shoulder width apart, slightly past, and toes slightly pointing out. Okay, you'll see all kinds of variations where people have been told. Okay, and this is why I say told, because this is my goal. This is my This is kind of the authority on it from me. The NCSA is kind of the authority on mechanics. So anyway, you don't want your toes pointing out at like 30, 45 degrees. You want them about 10 degrees. So that way the knee has the ability to track right over the foot. It's recommended that the athletes do not exceed 30 degrees of internal rotation or 80 degrees of external rotation to maximize stability and promote normal patella tracking. Okay. So, and then we're going to go into head position. So maintain the head and neck in neutral alignment, because if we go up, then we're going to lean forward. If we look down, we're going to round our spine. We open ourselves up for injury. Okay. Our gaze needs to be straight ahead or slightly upward, because again, our body and our spine is going to follow our head. So if we look down, our neck's going to go down. When our necks go down, our thoracic and our lumbar curves are going to flatten out. If we look up, we're losing that thoracic kyphosis. We're going into kyphotic extension, and that is also bad because now we're loading things that shouldn't be loaded. And so we want them looking straight ahead. You can see that her hands are pronated, her elbows are driven back, and her scapulas are retracted. Don't want them looking down because it's going to flatten, it's going to curve out their spine, and we're going to load things. The thoracic position, adequate postural stability, and control the upper torso as optimal squat techniques. That's why we don't flatten, we don't go into extension. We just want to retract the scapulas. And held rigid. All right. So trunk position, going into trunk position, the body's core is a critical modulator of the lower extremity alignments and loads during dynamic tasks such as squatting. Okay? This can, if you are treating somebody for low back pain, this is a great exercise to do because what does it do? What does it require? What does a vertical loading of the spine or a dynamic activity require? Okay? It requires activation of our transverse abdominis. And as we've talked about, it requires stabilization of our multifidi. So as we've talked about, those things are important when we are treating people with chronic low back pain. Right? Now, we're not going to do this day 1. We may not do this in week 4, but this may be a goal that we work toward, is getting them to be able to have a functional squat position. Okay? Decreased core stability, muscular synergism of the trunk and hip stabilizers negatively affect performance in power activities and may increase the incidence of injury due to lack of control or the reason that they are coming to us with low back pain. Okay? The squat can instill mechanics that improve trunk stability during dynamic tasks. So we want to maintain a slight lordotic curve in the lumbar region while holding the abdomen upward and rigid to promote stability. Okay. Common deficits, it may collapse downward into excessive trunk flexion. Okay. We've talked about the guide wire. The muscles form a guide wire system that prepares the flexible spinal column to bear the load, and they must be activated. So culprits for increased trunk flexion during a squat are weakness of the thoracic and lumbar paraspinals, weakness of the parascapular musculature to maintain the retracted and depressed scapula, and reduced tension in the thoracolumbar fascia through the integration of what? Ding, 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 ding. The posterior chain. Anytime we talk about mechanics, we have to talk about the posterior chain. Just how it is. That posterior chain needs to be strong. If it's not strong, we're going to end up with deficits. Okay? Our hip evidence suggests that maintaining a neutral pelvic tilt during the squat increases the activity of the rectus spinae. So what is a common deficit that we see? We see an anterior pelvic tilt. You've all seen the guys. They line up in the cages. They throw their stomach out. They throw their stomach out forward. They throw their butt out, and they get a humongous lumbar curve. Okay? That's not how we stabilize. We're not stabilizing things at that point. We're getting those muscles into a shortened, weakened position, whereas if we maintained a normal or neutral pelvis, we would be an optimal length to provide stability. And the squat can be an effective training exercise to promote the development of gluteal strength for the hip. We are recording. We are. Great. Okay. All right. So they prevent the knees and hips from rotating inward. Oh, yeah. So this is a big one. So during this ascent, the hamstrings can assist the gluteal muscles by controlling flexion at the hips. In the ascent phase of the squat, the distal hamstrings contract to control the hip. The hip abductors and muscles of the hip and outer thigh, including the gluteus medius and the gluteus minimus, stabilize the femurs during the squat. They prevent the knees and hips from rotating inward during the descent. Okay? So those muscles right there that we are training during the squat with the proper mechanics, they are preventing the knees and hips from rotating inward. Okay? What happens when the knees and hips rotate inward? We stress the ACL, the patella starts tracking laterally, and bad mechanics happen. Okay? So we need those muscles to kick in. We need those muscles to be strong so that it drives those knees out and they can now track properly over the feet. Keeping those pelvis in a neutral position. If one side is weaker, you're going to see that pelvic shift. It's going to shift from the weaker side over to the strong side. It's going to do a little lateral shift and tilt. So people may need some cues to stay right in the middle. So the frontal plane of the knee should track over the toes throughout the squat motion, visually evident as a neutral frontal plane knee position throughout the movement. An absence of knee displacement, both medial and lateral. Those knees should track over the toes. All right. So common deficits, excessive medial lateral movement of the knee signals a functional deficit or valgus or varus frontal plane movement can be attributed to poor neuromuscular control and lack of function or strength of the lower extremity muscular, especially the posterior chain. I'm telling you, it comes up every time. I have this for louder than the people in the back. Okay? Weakness of the lower extremity musculature in the posterior chain will lead to valgus or varus. Okay? This goes back to our argument of our orthopedic surgeon or our orthopedic friends who write VMO strengthening for patellar tracking issues. Baloney. Don't feed me that garbage. Okay? We need to strengthen the posterior chain. If we want to improve knee mechanics, that's where it's at. That's where we make the money. Okay? If that knee drops in, it's that posterior lateral hip that we now need to address. Okay? Strength, stability, posterior chain weakness. Leads to passive valgus. Circle that, star that, bookmark that, come back to that. All right, knee position. Okay? We don't want that, obviously. Or tibial translation angle. What that is talking about, the tibial translation, is the amount of forward tilt the tibia gets. Okay? The old adage is when you squat, you do not want your knees to go over your toes. The anecdotal evidence or the medical evidence for that of the knees passing the toes is not very strong. Okay? You don't want excessive, you don't want it way up because now we're throwing off the mechanics and everything else. Okay? But having your knees go slightly past your toes is okay. Okay? So although the general goal should be to maintain a positive shin angle, this objective should be accomplished by proper hip joint mechanics as well. Lack of strength of the posterior chain, particularly the glutes, to keep the load on the rear. Excessive tibial progression angle can be a result of weakness in the calf, soleus, weak hamstrings, or quadricep dominance. Posterior chain, posterior chain, posterior, 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 posterior chain. That's what's going to get you the results that you want. Okay? And in foot position, that foot needs to stay flat throughout the entire squat motion. Okay? Lifting your heels or toes off of the ground at any time is suboptimal because it allows to create compensatory torques about the ankles, knees, hips, and lumbar spine. And this is what we went to over on Tuesday. Lack of dorsiflexion mobility if the heels come up off the ground. Okay? If your patient cannot drop their heels and do a deep squat, that's the first place I would look, is the dorsiflexion mobility. Okay? The rest of this talks about the descent and kind of doing that hip hinge, kind of sticking your butt out first instead of crouching down first. Okay? And then the ascent, or going up, how you need to lead with your shoulders going up, or push your chest up instead of trying to push your butt up and then following with your shoulders. Right? That arrow is indicating that they're pushing the hips forward and trying to lift the chest instead of, when you're down, trying to push your butt up. That right there of pushing your butt up and leaning forward is a sign of glute weakness because you can't get your hips back over your feet. So again, a very, very well written, very thorough article, lots of explanations. I implore you to look at this further. We will go through it a little bit more in lab. All right, so on to the back, or the deadlift. Okay, this is exercise number 2 that I think everybody should do. I know I need to do it more, that's for sure. Okay? It's becoming a more common idea that strength training should be utilized in every population for maintaining general health and varied performance goals. So totally true. And there are a few substitutes for the deadlift. Okay? So that one just says that almost all job in any tactical field requires stabilization of the trunk while expressing large amounts of force to the lower extremities. Okay? And that's what the deadlift does. While the squat works on the hip, the glutes, and the posterior chain kind of below the waist, the deadlift focuses on core stability while also allowing the glutes to fire maximally. The deadlift requires the upper and lower extremities to move or stabilize the bar, which engages a large number of motor units and muscle fibers fire simultaneously. Okay? Proper execution of deadlift and the ability to stabilize the trunk and spine while exerting maximal effort. Okay? Is a skill that can help tactical personnel and the general population avoid injury or regain control. Okay? So we talked about kind of chronic low back pain, and ultrasound imaging of chronic low back pain indicates that a firing of the multifidi is impaired. Okay? Once we get their multifidi firing, we like their mechanics, we think that they're getting stronger, we are going to start them with deadlifts because we have to continuously challenge the system if we want to get it better. Okay? So this just goes through a few pointers. Head posture. The head needs to be looking slightly upward. Again, this is to keep the back as neutral as possible. Shoulders to stay back and the spine to stay in a more erect, neutral position. So again, if you're looking down, you're going to round your spine. And what happens when you round your spine is that you now bend over, your hips go up, and now you just do a pickup of heavy weight with your lumbar spine. You're going to load it incorrectly, and you're asking for an injury. That's like if I pull up, I can do this. This is awesome. I'm not in a PowerPoint. I can do this. Let's look at his mechanics. Oh, for the love.
thousand people out there know you can. I want to see him do it.
First of
Let's
all,
make
he's
it
wearing a
now.
suit. Don't
500
get me started on
kilos,
this suit.
pounds. He breaks the 1,001.
Okay, we don't need to watch him put his suit on. Look at his flex posture. Okay? First of all, when he first starts his position, what kind of position is he in? Horrible. That's his position for his deadlift. That's horrible. That's not a deadlift. That is not doing what the intended to do. Okay? Just before, right after he lifts, okay, look at the position of his spine. Okay? Nothing good can come from this. Okay? He's not doing the exercise. He's not stabilizing his low back. He's using his low back in a concentric manner instead of doing what he needs to do. Okay? So, head and neck, head needs to be looking slightly upward, okay, to keep the spine in a more erect and neutral position. Okay? First step, head position. Next step is lat activation. Okay? Pulling your shoulders down and back to set your back, to stabilize your back. Okay? The article states that it helps the bar stay closer to the lower extremities and you don't get that large torque arm or that large lever arm. Okay? I say that activating the lats creates a posture that is advantageous to lifting heavy loads. Okay, because you're keeping by setting the lats, you're now keeping your lumbar spine in a standard or a stabilized position. Okay, this one right here, this sentence, preliminary activation of the lats also reduces the tendency for the shoulders to drop, keeping the thoracic and lumbar spine more vertical and less likely to round into flexion. Okay. Tip 3, always try to push the knees apart. So when you are especially when you're initiating, you're trying to push those knees apart before you go up. That helps sets the glutes, can help the glutes remain active during the lift. When first learning, most people tend to use all quads, hamstrings, and spinal erectors to pull the weight, meaning that they straighten their knees and then stand up, like the heavyweight guy that we just showed. And number 4 is train to your weakest position. We're not going to go into that too much. And we'll go over the proper mechanics. I'm a very... the whole powerlifting world has me kind of set on fire. Because it's just... They preach about mechanics, but then their mechanics suck. And I don't understand it. Alright, that's all I've got. That's all I'm talking about. 30 minutes, not too bad. But we will go over this in lab, and you'll probably hear me rant on and on more about this. All right, I'll see you online.